On this week's Working in the Valley segment, I've got a couple of experts in dental care with us today, Dr. Jason, Dr. Terry from the Robinson Smile Center in Robinson, Illinois. And today we're going to talk about the topic of sleep disorders and how that relates to our teeth and our mouth. And Dr. Terry, what do you see in terms of those kind of issues with the patients that come to the Smile Center?
Well, Doug, we do a lot of orthodontics, a lot of functional orthodontics, and I deal basically with kids with airway problems. And out there, a lot of kids have trouble sleeping at night. They have trouble breathing through their nose. They mouth breathe. This can cause a lifelong set of problems. We've got functional appliances that will help expand arches, but we need to make sure that we get kids so that they can breathe through their mouth.
Probably early detection of that, I would say the quicker they can come into you and get some help, the faster they're going to see results.
Well, that's something the mom can do. They need to start watching their kids sleep at night and make sure that they're sleeping through the whole night, not snoring all night. Sometimes even simply grinding their teeth is an indication of sleep problems. And with kids, an ENT consult may be all that's necessary to take care of some of those problems very early in life, and that's good. And that cuts down a lot of the problems later on that the 40s, 50s, 60-year-olds start to see.
And I want to get to that. Dr. Jason, tell me a little bit about the adults, because I know a lot of adults are diagnosed with sleep apnea and different types of sleeping disorders. Is there still hope for them to get some of that corrected?
Absolutely. And the first step is to go through the diagnostic process and determine what it is they have. And we have some things we can send home with them to get an initial reading of their sleep condition. We often recommend then a full sleep workup with a sleep center. But then we can help tremendously by oral appliances. Sometimes it's just a change in habits, but ultimately trying to help them breathe to get restful sleep to improve their lives.
Now, you've brought some photos with you as well today. Let's talk about these different images. It might help people identify what their own needs are. What's the first photo we're looking at?
Well, the first photo is somebody that didn't get any care when they were young. Basically, what you're seeing right here is a monster tongue, an open bite. This is caused simply because somebody couldn't breathe through their nose. The second one is an extremely deep bite. Look at the size of the tongue in that mouth. Mouth breathers tend to have all their tissues really swollen, really enlarged, and it's just no room for error.
Now, in both these cases, Dr. Jason, is there still hope that they can breathe somewhat normally with some dental care?
Yes, and that's where some of the testing comes in, is if we can open the airway while they're sleeping, either with an appliance or with forced air with a CPAP, then we can get them that air their body needs. That can allow a lot of things to heal, to improve, and then ultimately if we want to do something else with their teeth, we can.
How important is seeing a dentist in terms of these issues?
I think it's tremendously important because we can oftentimes be the first line of finding it out. Because we're looking right in that area where there's direct effects.
And of course, if somebody wants to schedule an appointment, they're watching us today thinking, gosh, this is something I need to get some attention on. How can they do that, Dr. Terry?
Well, they can call the Robinson Smile Center, 618-544-2626. We would be absolutely happy to get them in, talk with them about their concerns, and give them a quick workup.
All right. Thank you very much for sharing the information with us.
Thanks, Doug.
Thank you.